happen. So let's continue to invest this way. I want to thank Christy Whitlatch, President and CEO of King's Daughter, and Donovan Blackburn, Pikeville Medical Center CEO and Vice President of the Board of Directors for their work. I also got to announce that the section of US 460 from the intersection with KY 80 at Beaver near Elkhorn City to the Virginia state line is set to officially open on November 16th. For a part of Pike County, they have been waiting decades for that news. It is going to help their way of life, their ability to do business across the border, and it's exciting news. Congressman Rogers and I also announced Colby Hall as the new executive director of SOAR. Hall is a native of Somerset, the University of Kentucky graduate. He has a huge amount of energy, and we're really excited to what he can bring to the region. Representative Rogers talked today about bringing young talent back to Eastern Kentucky. I think it was right on. All this positive news for Eastern Kentucky in the same week that we announced $6.6 million in ARC grants. And here's some great news. This year, just through the Appalachian Regional Commission, we will have had the most funding of any state in decades, over $36 million going to help infrastructure, create jobs, provide better health care. It's an exciting time that we are investing in Eastern Kentucky. Also have some good jobs news for Bowling Green. Even though we're battling this pandemic, we work every day on economic development. I actually had a call with a different facility about potential expansions just this afternoon. This is Nova Steel USA, which plans to locate a steel tube manufacturing facility in Bowling Green with a $70 million investment that's going to create 110 well-paying full-time jobs. The project will support automotive, construction, mining, agriculture, and transportation industries, among other. They're purchasing an existing 108,000 square foot building in the Kentucky Trans Park, which the company plans to grow to over 300,000 square feet. This is Nova Steel's first Kentucky operation. We welcome them to be a part of Team Kentucky, and as I've told them, feel free to grow. The company will be a part of a primary metals industry in our state that includes 220 facilities and employs over 25,000 people. It will also be the 35th Canadian-owned operation in the Commonwealth. Canada has been such an important trading partner for us. We have over 500 internationally owned facilities representing 32 nations in Kentucky. Canada is the fourth largest international investor in our Commonwealth. We have 112,000 people employed by internationally owned manufacturing, service, and tech companies. So we absolutely appreciate and are excited about this direct foreign investment where we're going to have new friends in Kentucky and new friends in Bowling Green. All right, Halloween guidance. It's our last opportunity to talk about it directly. If families follow this guidance, we think that trick-or-treating can be safe. If you don't, it is not. So please, if you are going to go trick-or-treating, remember the CDC says you shouldn't. My kids aren't going, that's a personal decision. But if you are going to do it, please follow simple rules and guidance that, again, is as simple as caring about your neighbor and caring about their kids. So only use individually wrapped candy and don't stand there with the bowl and hand it out. Make sure that you use hand sanitizer first and then you set it out. You can pick a table, you can put it out on the patio, however you want. Don't leave it in a bowl for kids to stick their hands into. You got to think about space and distance. If you're taking your kids trick-or-treating, just stick with the family itself. Make sure that you're not doing it in big groups because, again, that's how COVID spreads. Always wear a facial covering and your Halloween mask doesn't count. Wear that mask underneath it. Trick or treat in your own neighborhood. Try to do less of it than you normally would. And when you get home with the candy, make sure you wipe it down to make sure that it is safe. Obviously, if it's not wrapped, don't wipe it. That's not a good idea, but please take care of your kids during Halloween. This is supposed to be a really fun time for them. I know it'll be different, but our kids are more resilient than we are. Follow the guidance, and that'll make it as safe as it can be. And I just want to mention, we cannot be having adult Halloween parties right now. When we show you the number of red counties, you'll see why. So if you're a facility that's out there and you're advertising for it right now, cancel it. Our Commonwealth needs you. We need you. So please make sure that Halloween this year is for the kids. I know that's a sacrifice, and it's a sacrifice especially for certain groups, but it's what we've got to do in the midst of a pandemic. All right, just a couple of examples of Mask Up Kentucky today. These are people out there doing it right, and we got to celebrate that. We celebrate our values, we celebrate our faith. Let's celebrate putting them in action by doing the right thing. Remember, if 90% of Kentuckians and Americans would wear masks, we'd save 100,000 lives. Think about it, 100,000 lives. That's what we could do together. Wouldn't it be amazing to be that generation that saved 100,000 lives by putting a cloth mask on and being able to wear it until the end of this? 100,000 lives. That would be a legacy for all of us together as a generation. People have sacrificed a lot more for a lot less. So please, let's mask up. All right, this first one is the neighborhood Halloween parade, which was a great alternative to trick-or-treating. They were staying safe, and this is, again, you see them wearing their masks. This is the way that we ought to be doing it. And again, you can see how excited the kids are. We can provide safe experiences for them, knowing that COVID is just a different year. Thank you for setting a good example for this neighborhood, and thank you for these kids for setting such a good example. All right, second piece is Robert, who is doing his duty in two ways. Number one, he's wearing a mask, and number two, he's voting. Remember, the election is Tuesday, and if you have not voted, we need you to vote early. Pick a time, make a plan on how you're going to get there. We need to spread people out, especially with our number of red counties before Election Day. Even if you're in a red county, I want you to get out and to vote. That's our duty as Americans. And if you vote early, then it can be as safe as possible. If you are in Jefferson County and you go to the Exposition Center to vote, you can also get tested with our surge testing that's out there with the federal government. We've got 200 of those today. James, can you bring up how to sign up for that from yesterday? We've got 200 spots on that today. We've got 400 on Friday and on Saturday and on Monday. This is our work with the federal government that is providing these test kits free of charge to us because they see the surge that is going on. All right, we'll come back to it. It is on our, there it is. This, of course, is on our website, just like all of our other locations, but it's an opportunity for you to drive up, vote in that super center, get back in your car, go get tested, get it all done in a short period of time, take care of yourself, do your duty. All right. Today's COVID report, 1,821 new cases of COVID-19. It's our third highest day ever. Yesterday was our second highest day ever. The day before that was our fourth highest day ever. Total cases now 103,305. I believe Ohio's governor, after they had the highest number of cases, over 3,000 today, described it as raging across Ohio. This is a type of outbreak where we can't deny our way out of it, we can't rationalize our way out of it, we can't try to find excuses for not following the guidance. It is that present. And if you want to say yes, but it can't get into my area or my facility, oh yeah, it can. If you don't believe that, look at long-term care. We test people coming into long-term care more than anywhere else in the Commonwealth. We have PPE that people are wearing that go into long-term care every time. Yet still, this virus finds its way in. If one of the most protected areas still can't stop this virus from getting in when community spread gets so large, neither can any of the other plans. So guess what? Our plan has to be to lessen the overall spread and to ultimately do it together. We continue to see so many school-aged children who are becoming infected. I know that there are different theories about transmission here or transmission there. The fact is our kids are getting this virus, 227 in today's report. Last 7 days, 1,322 kids under 18 testing positive for COVID-19. Currently hospitalized, 969 Kentuckians, again increasing. ICU, 234 Kentuckians fighting for their lives, 120 Kentuckians on a ventilator, and a 6.04% positivity rate. When we look at new cases by county, it's going to take a minute again, because when we have this many cases, we have this many counties with double-digit cases. Jefferson, 331, Fayette, 127, Hardin, 65, Kenton, 52, Warren, 47, Christian, 44, Nelson, 42, Campbell, 41, Barron, 40, Clay, 38, McCracken, 37, Pike, 36, Boone and Hopkins, 33, Callaway and Montgomery, 26, Madison, 25, Marion, 24, Floyd and Whitley, 23, Bullitt and Davis, 22, Bell, Lee, and Marshall, 21, Scott, 19, Caldwell, 18, 17 for Henderson, Knox, Laurel, and Oldham, 16 for Garrett and Hart. Boyd, Carter, and Jackson have 15, 14 for Harlan and Monroe, Logan 13, Shelby 12, 11 for Anderson, Franklin, Graves, McLean, Perry, and Taylor, and 10 for Jessamine and Webster. Now remember, we've got about a 1.4% mortality rate right now in the Commonwealth for COVID-19. That's a lot better than the national rate, and thank you to all of our healthcare providers that have helped us do that much better. But 1.4% of 1,821 cases is a lot of Kentuckians. And as you know, deaths follow cases, and so today I'm sad, I'm sorry to report 19 additional Kentuckians that we've lost. I've had to read a lot of entries lately, and I'd like to read a lot fewer because they mean that there would be fewer families that are suffering. And if you've talked to a family that has lost a loved one due to COVID-19, you know how painful it is. Probably in many ways more painful than losing one outside of COVID, because most of the time you don't get to see them much in the period before they pass. And then the way that you try to recognize and memorialize them is very difficult afterwards as well. And then you may go out in public and see people not doing what it takes to protect other people, and you think in your mind, I just lost my family member. Can't you at least try and help others not lose theirs? This is really hard on their families. We've lost 1,461 Kentuckians due to COVID-19. This is, I mean, if it hasn't touched you, someone you personally know, it's just a matter of time at this point. So please, help us save lives. Every day you get up and put on a mask, you save lives. Every day you follow the guidance, you save lives. If you are a red county, when you follow what we need you to do in the recommendation, you are going to save lives. Most of us don't get a period of time and we think COVID's lasting too long. It is. But we don't get a period of time where our actions every day doing small things can save lives. Well, you know what? We've had a lot of months where that's the case. I hope that we have the strength to continue to want to save lives around us. I know I do, and I know the vast majority of Kentuckians do. So here are the 19 people we've lost. 68-year-old man from Adair, 75-year-old man from Callaway, 93-year-old man from Casey, 81-year-old man from Davis, 65-year-old man from Fayette, 90-year-old man from Jefferson, 83-year-old woman from Jefferson, 88-year-old man from Jefferson. 88-year-old woman from Jefferson. 73-year-old man from Jessamine. 72-year-old man from Lee. 61-year-old woman from McLean. 80-year-old woman from Meade. 71-year-old man from Muhlenberg. 68-year-old woman from Rowan. 58-year-old man from Russell. 68-year-old woman from Shelby. 87-year-old woman from Warren. And an 89-year-old woman from Whitley. Please turn those green lights on tonight in honor of these 19 people. Please ring your bells at 10 a.m. tomorrow in honor of these 19 people. And please put on your mask to make sure we don't have to read 19 more names. And even if that won't get you there, how about you do it in honor of these families, because you know some of them. All right, with this amount of spread across the Commonwealth, it's not going to be a surprise that today's incident rate has a significant number of red zone counties. This being Thursday is the day that sets guidance for schools as to in-person learning versus a hybrid versus a broader in-person experience. So today we have 68 red zone counties that will qualify and fall in to the school guidance, to long-term care guidance, and to our red zone recommendations. The red zone counties, 68 red zone counties, are Adair, Allen, Barron, Bath, Bell, Breathitt, Bullitt, Butler, Caldwell, Callaway, Campbell, Carter, Christian, Clay, Clinton, Cumberland. We're just on the C's. This is how much virus we have right now, and the fact that we can't say it's just in one community or one county, it's everywhere. Elliott, Estill, Fayette, Fleming, Floyd, Garrett, Hancock, Hardin, Hart, Henderson, Henry, Hickman, Hopkins, Jackson, Jefferson, Jessamine, Johnson, Kenton, Knott, Knox, LaRue, Laurel, Lee, Lewis, Logan, McCracken, McLean, McGoffin, Marion, Marshall, Martin, Menifee, Metcalf, Monroe, Montgomery, Morgan, Nelson, Owsley, Perry, Pike, Robertson, Rockcastle, Russell, Scott, Shelby, Taylor, Todd, Union, Warren, Washington, Webster, and Whitley. We now have over half of our Kentucky counties in the red zone, and we are down to a handful, maybe 4 of yellow counties and no green counties. So what that means is we need each of those county governments, city governments and them, to be making plans for Monday to be as virtual as possible. We need every business in those 68 counties that can have people from work from home to do it, not to lessen your capacity. If people can work virtually, we need you to let them, because their kids are going to be home learning virtually if the school system is following the guidance and recommendations. If you are in one of those 68 counties, and most Kentuckians are, we need you to reduce your contacts as much as possible, really starting now, but certainly Monday through Sunday of next week. Don't go out unless you have to. Don't have gatherings. Try to do curbside shopping if you're going to do it. Reduce the number of times you're going to the grocery store. If there's an option for them to bring it out, do it. It's unsafe right now, and this helps protect you, and it's all of us working together. If we can all do this and all come together to tamp down cases as quickly as we can. I mean, this is exploding across our nation. It's threatening to take more lives than in the last couple months we ever fathomed we could lose, and so we need your help. And it's also helpful for our long-term care facilities where this virus seeks people out. 71 new residents have tested positive, 42 new staff, and 5 new deaths attributable to long-term care. All right, we have an update on unemployment insurance with Amy Cubbage, and then we will take questions. That one.
Good afternoon, and thank you, Governor. I'm here to give you a few brief updates on our unemployment insurance program in our system. First, we're going to start pulling our numbers for you in a slightly new way. We have been reporting our outstanding claims numbers based on essentially the last date worked, but that can also mean that someone could file a claim literally yesterday and put March, and we're reporting that to you as a March claim, and we're working it as a March claim. We've decided to go back and pull it based on date filed. We think that's a fairer system. So based on that, you will see some differences in how we are reporting numbers. For instance, we are down to only about 800 claims filed in March with unresolved issues, and then we are going to move on to those that were filed in April. I know that we've had a lot of questions and concerns about the Pandemic Unemployment Assistance Program, and in particular the overpayment notices that a lot of claimants have gotten because they chose to either self-quarantine or leave their job because they believed that it was an unsafe workplace. Just to give you a little short timeline about this, March 19th was when this new program was first started to be discussed. This was as a result of the CARES Act being filed first in Congress, and we started having discussions with our federal representatives and Department of Labor, who told us that this program was coming and indicated that people would be able to be covered through an alternative program if they had to leave their job because of a health reason or because of an unsafe workplace. So we come to March 27th, and that's when the CARES Act passed. And so we started our rollout at that point. We got some preliminary guidance from the Department of Labor on April 7th, and it did indicate, consistent with what we've been told, that people could be approved for these claims if they had medical issues, if they had lived with someone with medical issues, or if they had an unsafe workplace. It wasn't until April 27th that we got an expanded guidance from U.S. Department of Labor that clarified, and remember, all of these programs were new to everyone because the pandemic was unprecedented, that for people who were going to leave their job to self-quarantine or because they lived with someone who had a health issue, they had to have a specific doctor's order to do that. So, of course, this is a federal program, and we are bound by the rules. So we were required to shift gears to start denying those, and then on the orders of Department of Labor, start writing what are called overpayment notices to let people know who had inadvertently received benefits under our mistaken interpretation that those would be due back. Secretary Roberts, at the governor's direction, has requested Department of Labor to give us some flexibility and waive some of those overpayments. So that is something we are attempting to do for you. We know it is a huge burden on claimants who, in good faith, applied for those benefits and now have been requested to pay that back. But we are hopeful that we will be allowed some flexibility, and we hope to have more news for you on that soon. I wanted to give you some information about some upcoming shutdowns we are going to have of the claims system. This is because we are putting on an update that is hopefully going to make it a lot easier from the claimant standpoint to get in and navigate and claim your benefits. Those shutdowns are going to be all day Friday, November 6th and November 7th. All day Thursday, November 26th through that Saturday. That's Thanksgiving weekend, so we hope that doesn't cause too much of a burden for people. And there's going to be a brief shutdown after business hours on December 15th. And remember, that is so we can put the new improvements on the system. We know, again, it is disruption for you, but we want you to have the best system that we can possibly give you. Now, last, be on the lookout for a Department of Labor email scam. There is a scammer out there sending UI claimants and others an email that looks to be from the Department of Labor. It will come from a spoofed email that it says PUA@unemployment.usdol.gov. It's not a real email, but if you're an unemployment claimant and get that email, you're going to think it's about your claim. Please do not click on the link in that email. It is meant to steal your identity. That's not even a real U.S. Department of Labor address. You will never get an email from the U.S. Department of Labor about your claim unless you've emailed them first. All emails about your claim will come from a ky.gov email account, and we will never send you an email that has a link to click in it. So with that, I will turn it back over to you, Governor.
Can we go back to the 4 pieces of the update here? I just want to talk about 2 of them very quickly. Number 1, here's why we're working on what I believe will be a more accurate way of reporting the amount of remaining claims that are out there. What we've been providing is, here are the March claims that haven't been resolved. The challenge is someone could have filed a claim yesterday, claim days in March, and that goes into the March pot. Now, it doesn't mean that that person was waiting since March. And in fact, it couldn't have been processed by our people because we got it yesterday. The way we'll be reporting them now are the dates that they were actually filed, that they submitted the request to qualify for unemployment, because that sets the timetable on how quickly we should be able to respond. And that will give everybody a better, clearer idea of how long people have truly been waiting. But it also helps us. It helps us be able to prioritize when previously we might have said we need to focus on March claims. And some people who didn't file that long ago may have had their claim processed quicker. This will hopefully let us go by the oldest claim first and make sure we get through them. That means that somebody who filed yesterday but claims dates in March but just filed yesterday for the first time will have to wait a little bit longer. The waiver requested to the U.S. Department of Labor, I want to be clear on this. The federal government, in almost all the programs during this pandemic, has sent out the money, has said, open up your program, has given us initial guidance, and then typically has waited a month to give us written guidance. And oftentimes that written guidance has changed multiple times. I'll give you an example, use of the CARES Act money. When the CARES Act money first came out, it was very, very restricted, and when we looked at it, we said, well, they sent us a lot of money. There's actually no way we're going to be able to spend this money on it, and it's not what we need it for. And then we get guidance about a month later that says, well, no, you can use it for these things that we said you couldn't use it for. But still, there were other ways that we needed to be using the money that they'd said were prohibited. And then we get another guidance about a month after that that said, now you can use it in these 3 or 4 different ways. We appreciate that flexibility. But in the midst of a pandemic, that's what we have seen. We have seen changing guidance. That's been the same here. And I believe that experts around the country have talked about this. The federal government originally said so many different groups are going to be able to qualify for unemployment, and they started dialing it back about a month and a half into it. I don't agree with it. I think people should be held harmless who got caught up in it. We've asked the federal government to do that. If they won't do it, we'll support the legislature doing it. I think those people should have been able to qualify. And when we talked about it, they were able to qualify. And I don't think that the federal government should pull the rug out from under them. Well, we care about them, and we want to make sure they get the help they need. And finally, back to today being Thursday. Again, now is the time for community leaders, business leaders, school system, government. You're in a red county, make your plans for next week. This is our shot, 7 days of getting out of the red. If you want to be competitive with another county next to you about who can reduce it the most, go for it. We'll recognize the winner between the two if you'd like. But we got to take ownership. We have got to take ownership. And sometimes that involves changing the mindset of some in the community. Folks, you guys can do it a lot easier than I can at this point. If business, government, our charitable groups, our school system, everybody's on the same page. That's people's organic community around them. And it also means that what you'll be doing will provide health and safety not just to the broader Commonwealth, but to those who live directly around you. And remember, as an individual, if you follow those recommendations, you will be safer during that week. All right, we will open it up to questions. We got a lot of media here today. I want to let them know that we're going to be working on a virtual option that we hope to be able to roll out next week that will allow you to ask questions virtually. That's arisen because we've had multiple people in this building, all of which thus far have tested negative, that have been asked to quarantine because of exposure with the rising levels of cases. We expect that to continue, and we want to try to provide as safe of an opportunity while still having the chance to truly ask questions, and I know not wanting to always submit it in writing, but to be able to ask it face-to-face and person-to-person. So we'll start with you, Debbie. So next week, our briefing schedule is going to be Monday through Thursday, including Election Day, because we'll be fighting COVID that day as well. Jared?
So last time we put in some mandates and restrictions back in March, when cases were much lower. Do you think those restrictions and mandates were successful, or those were successful? What's different this time around? Cases are much higher.
So this is the question about, we did mandates before, why aren't we doing mandates now? First, we have a lot of mandates already on the books, and we got to acknowledge that. We're not starting at a zero sum that we did in March. We have, can you bring those up, James? Significant, and we have more aggressive mandates in place than any of our neighbors when you look at their totality. We have one of the strongest mask mandates. We have the toughest restrictions on bars and restaurants, and we have a curfew. Some just do either or for that. We're still at 50% capacity for businesses that are there. We have gatherings right now at 10 or less. We have visitation restrictions at long-term care facilities and hospitals. Colleges and universities, we have specific plans with certainly indoor and outdoor arenas and others. We have some of the most significant mandates in place, not just actually of our neighbors, but probably going as far south as you can in our country where we are. I put all these in place because they were at the request and at the advice of public health experts. And I have promised to be following that advice from the beginning, and I have not had either from the federal government's health experts or from the states any recommendation to add a new mandate. That advice has not come to me. If it does, we'll consider it as it comes. But what they say to a person, White House and down, is these actually should be enough. Compliance is our issue. And if not enough people are following a mandate, will another mandate help with that compliance? And so our goal of, I'm being really clear about our goal of the red county reduction recommendations is to truly amp up compliance and do it all at the most effective and efficient time. Tom?
How much total has the state gotten? How much has been spent? And it all has to be used by December 30th, correct?
So the question is on our initial CARES Act round. We can get you a full accounting of that. We have already spent, significantly more than half. But at this point, we've got some last requests coming in, but we believe by this time next week, we will have fully accounted for how we're spending every dollar. We've had some last requests for increased testing where we are, and some increased purchases of PPE, but then we're going to put a significant amount and all of the remainder to repay part of the loan we took from the federal government to provide additional unemployment. We believe there's going to be at least a couple $100 million going towards that loan, but every additional request that comes in, remember, and it comes from all different places, would take away from amounts that we are putting there. But I think we are going to have, by this time next week, a full breakdown by category of where every one of those dollars is going. Joe?
As far as the 68 red zone counties that you're talking about, I want to make sure I get this clear as far as the metrics you're using. Are you using the state metrics that are included in the school reopening plans?
Yes.
Versus the White House plans, which I believe are a little bit different as far as how they categorize red zone counties?
So for the red zone recommendations, we are using the exact same metric, which is incident rate on a 7-day average per 100,000 individuals. that we use with schools and with long-term care, so it creates one metric. We believe our metric is superior to what the White House is using because we get the audited numbers, right? Because every day we remove some duplications because so much data comes in. It's one of the reasons that Johns Hopkins positivity rate is different than ours. What they do is they use a web-based it's not a system, but they use, they've got a tool that basically combs the web every day and just pulls the numbers we announce. And so what they don't get is the benefit of that back-end audit where there were at least, if I can pull it out, how many duplications from yesterday that we go through. The White House pulls its data from a different data source. We believe it's helpful to put it all out there, but take Fayette County. I know that the White House has them in yellow. Fayette County knows they're in red. We know they're in red. We agree on the overall number. Fayette County is caught up on how quickly they get cases in. We believe it's accurate. But no tool is going to be perfect. But here's the problem. If people try to argue around the tool, it's to get to a certain result. We don't see people arguing around the tool to begin the red county recommendations earlier. That doesn't happen. And if you argue around it this time and you want to say, well, we want to use these numbers, are you going to switch the next time to use other numbers? One metric, even if it's not perfect, is going to be the best way to have consistent, community-wide responses. Because the moment one part of the community starts saying, we shouldn't look at this number, we should look at that one other part says, well, I think we should look at this one, and none of us need to do anything. Red is red. If you're at that incident rate, it's pretty bad. Catherine, who's behind?
Karen, did you want to go for
Karen, I think you're slightly.
Oh, it's okay. This may have been asked, and I apologize if I missed the answer, but we had a few listeners who have tested positive and did not request absentee ballots. What are their options, if any?
Let us get an answer from the Secretary of State and the Board of Elections on that. If someone has tested positive for COVID, I believe there is an emergency health allowance for an absentee ballot, but let's get them that information directly. I know they have it. I think they have it up online, but we'll work with them to get that to you tonight. Yes, if you've tested positive and you're infectious, we'll find a way to get you an absentee ballot. Don't not tell anybody and go to the polls.
What's your message to bars, restaurants, other businesses who may struggle under those red zone recommendations? Do you believe there's any more help coming for small businesses?
Yeah, the question is about restaurants, bars, and other small businesses and businesses that are going to suffer under the red zone recommendations. What we're hearing from them is this is a lot better of a solution than other alternatives we've had to use in the past. What I would say is, I'm sorry. The virus doesn't care about our norms. Sadly, it doesn't care about our finances or our way of life, but it can be deadly and it spreads aggressively. My hope, and certainly my call, is for communities to support these businesses during that week. Order takeout, use curbside. By knocking it out of the red zone as quickly as possible, we will have more weeks where more people can frequent those establishments. And it doesn't push us to a point where we have to look at reductions like we have seen in the past and that we've been asked to do. This is our way to not have to do what we did in July, which I know was pretty painful. And for those that are going to go out and need to do these things, make sure you reward businesses doing it right. Go to places that are enforcing mask mandates, go to places that are providing the healthiest opportunity. Let's incentivize those as opposed to going to a place that's not doing it right. And then the business that is looks over and says, wait a minute, I'm spending all this money and I'm maybe even losing customers to do it right and people aren't coming. Stu? The question is, do we have evidence or advice from other states or others about what we are doing and whether it will bring down case numbers? The White House, in its most current report, talked about needing to rally communities together. They talked about having no gatherings in red zone counties. They talked about a number of the other things that we are doing, encouraging people to stay home as much as possible. I think when we look at the response in different times, whether it was Florida or Texas, when they were surging in a very different way, we see some data that shows it'll work. And we believe, we know that compliance is our biggest problem right now. And the very clear intent, and I don't think I can be clearer on it, of this, is to try to bring a specific individual, smaller community together to take ownership of the problem and the challenge that they've got. And we know if that happens, that'll increase compliance. Shelby.
We're hearing about several large-scale events that are still planned for Halloween and beyond in counties where the local health department leaders are telling us they feel their hands are kind of tied as far as enforcement. Any advice or comment on that?
Yeah, the question is on, there's still some large Halloween adult events or child events that don't follow our guidance planned. I mean, come on, folks. We just had our second highest day, our third high, in the last 3 days, we've had 3 of our 4 highest days. It's dangerous. Don't put your community in a worse position. You might not think you're at risk, but if you're opening your doors and asking a ton of people to come in, what are you possibly doing to them? To our local health departments, I would ask them to work with their communities and their community leaders. But I'd also ask them to be very clear that it is dangerous for individuals to go to large gatherings right now. If we can't appeal to the venues or the groups to do the right thing, to do the thing that saves lives instead of takes them, I hope we can appeal to the individuals themselves so that we don't end up with people being harmed, where if they would have known the danger that's out there, they would have skipped it. Who pays for COVID testing, and if it's funded through CARES Act, what happens when that money runs out? So for the surge testing that we announced, it's going to be done at the Exposition Center in Louisville and a to-be-determined location in Lexington. The federal government's actually providing those tests directly. For the Norton testing facility in Louisville, we bought the tests with CARES Act money, and Norton administrates them at their own cost. For the Louisville U of L run testing facilities, we bought the tests and we pay an administrative fee to U of L for administering it. That is the same at Lexington with UK. We also provide kits that we have bought to hospitals all across the Commonwealth, and then we can use those as well when we have to test large facilities like prisons. A lot of the other community, we are also providing tests to those 4 regional mobile units that we have, all purchased with CARES Act money. Most of the remaining 200 plus testing locations around are charging insurance or Medicaid in order to pay for those. What happens when December 31st hits and the federal government hasn't lengthened our time to spend money or passed a new CARES Act? We fall off a cliff in just about everything we're doing to fight COVID. No more money for testing. It's gone. We'll have a reserve, but that'll run out. Ability to purchase PPE, if we are continuing to surge in that, gone. Our ability to have the strike teams that right now we pay Norton and others to be able to come in and help nursing homes that are in need, that funding is gone. The testing that we send out to nursing homes for their individuals, the workers, gone. I mean, so many areas, we will go from doing our best to fight this virus to not having the resources. And so, I mean, come on, Congress. I mean, do your job. Certainly do it in a pandemic. Don't leave all of us high and dry. Yeah, let me do Debbie and then we'll cut over.
Are you enlisting the aid of local officials in your effort to implement the red zone guidelines? And if so, what response are you getting?
The question is, are we enlisting local leaders? We have had a call with mayors and county judges and superintendents today in the way they work together. I think the response has been really positive. With mayors and county judges, it was primarily how it works, how the schedule works, then them thinking through what we can do virtually and what we can't and what's necessary, how they can support their local communities and those businesses that we're talking about. I'm seeing a really thoughtful response. Now, everybody might not do everything we need them to, but I'm seeing our local leaders who have been, I think, really phenomenal during this, ready to step up again.
So, you said compliance is a big issue on some new requirements or anything. Wouldn't, in some cases, mandates or closures where appropriate sort of take non-compliance off the table?
So the question is, would mandates or closures take compliance off the table? Well, I mean, only if people follow those. So if we have a facility that we say, you know, you can't be open unless people are wearing masks, and they run the facility without people wearing masks, well, they're not allowed to be open right now. That's a mandate. And enforcement is a challenge. It's a challenge. We are working in the state with our labor cabinet. We're working with ABC to try to take those steps. Some local health departments are trying to take those steps. But again, if our current mandates, which aren't as tough as closure, we have trouble getting compliance. A new mandate that, again, you know, our best outcome here, right? The way the equation works is the best rules, recommendations, restrictions, whatever we want to call them, the best steps in place, times the number of people that are willing to follow them equals our best result. And if we end up losing whole communities based on the next steps that we take, I believe our situation could get even worse. But again, I haven't had mandates suggested to me by any of our public health officials, and that's always where the steps we consider start from. Tom?
I'm going to get to ask this one because we're coming up on Halloween. A lot of people in Frankfurt watch this and listen to this, and one of the biggest traditions of Halloween in Frankfurt is getting trick-or-treating at the governor's mansion. Will that be done this year or not?
Yeah, the question is, here in Frankfurt, one really special thing that occurs every year is trick-or-treating at the governor's mansion. Yeah, it's something we were really looking forward to. We were really looking forward to it. We had plans about, and especially when we were, you know, in yellow, how we thought we might be able to do it safely. But my family just went through quarantine. And we're not going to hold an event that in the very least could lead to other families having to go through that quarantine. So we are not going to be doing that trick-or-treating at the mansion this year. If people want to come by and get pictures outside, we got some decorations up, and we encourage that. But we're going to try to set an example, even if it is a hard example. Now, next year, I think we're going to be a place where it's on. And we'll figure out a way to do it in a big enough way to hopefully make up for all of it.
Do you have any sort of figure or data on how many people overpay, or how many people overpaid benefits, and how much money those people actually owe?
Okay, so you mean those that have been overpaid on a regular schedule and how much they owe? Let me get that figure for you if we have it. You know, there are certain individuals that have been paid for a few more weeks, and we are trying to get letters out to them. Admittedly, with short-staffed, and I've said this before, we've got most of our people working on people who haven't been helped. We've had people reach out to us, and each time that happens, we say, just save the overage. I know that's not the best. I mean, in the best scenario, we'd be able to work that and go ahead and get that money back in. But every person that we put on doing that right now is a person that is not processing claims. And with the volume, we just need as many people as we can. But we'll try to get you a number if they can calculate that. Karen?
Unemployment, for anyone who is overpaid, could they potentially face penalties or interest?
For those that have been overpaid, I know from my end, we're not going to charge them interest or penalties if it's us taking too long to get back to them. So that wouldn't be right. And they haven't told me that we have to do that from the federal government. And if the federal government is saying to do that, we'll look for a way around that too. And every other state has faced this particular issue, some in very large amounts. Again, we're gonna try to approach each situation in a way that doesn't harm or penalize the person.
Now it's primarily spread within communities, or because some of the states are still hot in other areas, it's still coming in from other states as well.
The question is on spread. We are seeing significant spread within communities, but there is no question that a lot of our spread is coming from our border states. If we backed up 2 weeks on the map, our whole state wasn't red, but more than half of the counties on this is from what, about a week ago, when you look at it. Well, maybe this is today. Well, what you would have seen is a lot more orange, a lot more yellow, but all that red down at the Tennessee border has been there, and that's because Tennessee won't put in a mask mandate, even though the White House is begging them to. And doesn't have any mandates, restrictions on bars, restaurants, and others. We also see the Evansville area being very hot as well. That impacts that area of western Kentucky that we see spread on our side too, and we probably see some spread from us to them. Northern Kentucky is actually doing really well if you look at what's happening right across the river. Hamilton County and Cincinnati is, I think they have something above red. It's purple, and who knows what color you come up with after that. So we are seeing significant spread. I haven't looked at West Virginia, but we're seeing significant spread coming from other states. We'll take one more from anybody if they've got them.
On that unemployment guidance, so the federal guidance changes April 27th. Was that ever communicated to the rest of the state, either at a press conference here or some sort of other communication?
I'm not sure that we did, or we going back. If we talked about the change in federal guidance, then it'd be on one of our YouTube or the rest. We saved them, and if we didn't talk about it, then we didn't talk about it. But what we did after the 25th is denied claims from then on for that purpose. But that's not the only guidance that's changed. It just continually changes, even to this day at different times, about who can qualify for what, and oftentimes the guidance that they give isn't clear. It's like the people who qualify for the $400 additional weeks are different from the people who qualify from the $600, and a lot of the same certification required. Anybody else? There have been other states, I believe, that have requested the waiver and/or passed something through their state legislature, which you can also do. Again, I'm for either one. I don't think the people should be penalized that got this when you were able to get it. And I believe in the federal government was saying that you should be able to get it. It's not fair, and we'll work to fix it. Let me go through. The latest White House report for Kentucky says we need a different strategy for reducing transmission, and suggested a time-limited rapid test and isolate competitive campaign between two counties with incentives for residents to come forward and get tested. This is the concept of putting together a true community push. We think we're doing that with the red zone recommendations. If we have the resources later to do this specific testing, we'd consider it. The problem is it takes so much testing from other counties, put it in just two, which might help those two, but it would leave others high and dry. But we think that this thing that the White House is suggesting, it's in their newest recommendations. It's their attempt to suggest something that is similar to our community approach to schools and long-term care and the red zone recommendations. It also says ensure retail establishments are complying with directives. That's saying make them enforce the mask mandate. Yes, the White House is saying that. We're using our labor cabinet folks, we're using ABC to try to enforce that as best we can. Also, it says schools, corrections, and healthcare workers should be using the Abbott Binax Now tests. They've been sent directly to nursing homes. We are sending them to corrections. they have a higher error rate than just about every other test, so we're making sure that the programs we set up know that so that we don't create false confidence. I know that we have some other questions here. We can get to them tomorrow as we run long. So thank you, everybody. I know that is a lot of counties in our red zone recommendations, but there is a lot of virus. This is an opportunity for you to help the people directly around you. Please follow them. Let's not be the people who try to find an excuse not to do what's asked. Let's set the best example. Lives are depending on it. It's a frightening time, but together we can address this, we can do better, we can save one another. Just be kind to each other. Being kind is wearing a mask and doing the things it takes to protect one another. Thanks.